Hey Fabio,
Hey Brandon, how's it going?
I'm good. How are you?
Good, just reading some EEGs.
Oh, are they exciting ones?
They're slowing, a lot of slowing.
Like what kind of slowing?
Well, there's different kinds. There's mild, there's moderate, and there's severe slowing.
You can characterize the slowing in a lot more detail and it matters.
There's no need. They're encephalopathic and they're slow.
That's what I used to think too. And then I got sucked into the wonderful world of slowing.
So how do you do that?
Well, let's learn about it.
What I think we should do is learn about the whole spectrum of encephalopathy. So we'll start with, types of slowing, and then we can move on to different epileptiform abnormalities, and then problems with voltage, like burst suppression or other varieties. And we can do, the seizures and birds and all the cool stuff. Because actually, what we are finding out is if you put these together and you can kind of learn how to weight them, and add up the different abnormalities, you can give someone a grade of encephalopathy that correlates with. And so with this better precision, we can really help our patients more.
Oh wow. Okay. Well,
And our colleagues.
yeah. So let's dive in.
Let's do it.
So let's just start with the basics here, just a reminder for everybody. So these are the four frequency ranges we usually use in EEG. Is that right?
You bet.
Okay.
But yeah, so delta is 1 to 4
Four.
oscillations per second. And it says here it occurs in deep sleep. That's true in normal deep sleep, but also it occurs in severe encephalopathy, as we'll see.
So the next tier will be theta, and it's 4 to 8, and it can be normal if they're drowsy, but it can also be abnormal if they're awake or ill.
Yep. And alpha, 8 to 12 hertz, that can be normal in a person who's closing their eyes in the back of the head, but it can also be abnormal if it's diffuse, or it could be the effect of drugs like propofol.
Okay. And then we have the nice beta, which is even faster than alpha. So 12 to 30 hertz cycles per second. And it can be normal in the focused state in healthy individuals, but it can be abnormal if they're ill, if they're on drugs or meds. So we're going to look at that as well.
Yeah. Let's take a look.
All right.
This is a good example of diffuse beta activity. So this is around 15 hertz if you count all those little oscillations. And yeah, there's some other abnormal things on this slide that we will not mention here.
Gotcha.
So this person's probably taking benzodiazepines.
Got it.
That's my guess.
So if they're on benzos, they have beta. So it's B for B, So what about alpha now? Pretty diffuse as well. So we see it pretty much everywhere. And if we count the cycles here in this one bar, which is 1 second, then it falls down into the 8 to 12 hertz. So it's alpha. And I think one important point is to differentiate from the posterior dominant rhythm, which is typically also alpha, right?
And sometimes we even call it the alpha rhythm, which is maybe confusing because this is not the alpha rhythm, even though it's in the alpha range, what we're seeing here. So what's the difference between the posterior dominant rhythm or alpha rhythm and this diffuse alpha activity?
I think the name helps a little bit. That's how I remember it. It starts with a P for posterior, so it has to be in the back of the brain. And this guy here is pretty much everywhere. And then the other one is that it changes around if you open and close your eyes, right?
The posterior dominant rhythm, yeah. Yep. It usually appears if you close your eyes and goes away if you open them.
It's another alpha example.
What's different about this alpha example?
I think it's it's diffuse as well, maybe a little bit more interior than posterior overall,
but pretty diffuse. So this is definitely not a posterior dominant rhythm.
Yeah, that's easier to distinguish, right?
Yeah.
There's a lot of slowing, although we're not going to focus on the slowing here. Just look at the alpha.
Yeah. I think this alpha, if you look at it, it kind of comes and goes a little bit, right? It's there in the circles, then it's attenuated, and then it maybe comes back, and it's attenuated, comes back. I think this is probably a person receiving a drug, like a sedative drug like propofol.
Got it.
Which causes both the slowing and that alpha
activity.
Together.
Gotcha.
All right.
Cool. got that out of the way. All right, now we have a PDR.
We already know about this.
We do. It's very different, isn't it?
Yeah, you can't see it in the front this time. It's really only in that, T501, T602, P301, P402, those posterior leads.
Right.
Yeah,
They're pretty good,
They're-
sinusoidal, good looking.
they are so good looking. Here we see, well, actually, there's two kinds of slowing, two frequencies of slowing. So there's some delta that you're circling there. And then the red parts, if you count them, I'm looking at the top one, 1, 2, 3, 4, 5, 6, 7, I think is what I'm getting. So maybe, 7 hertz, which is theta.
Okay. Can I do this one?
Yeah.
This is 1, 2, maybe 3, 4, 5, 6, 7 as well. So theta as well. Okay.
Yep.
And why is it irregular? What does that mean?
Oh, yeah. So it's not, that means not rhythmic. So that's the opposite of rhythmic. We'll see some examples of rhythmic theta activity, but if it were rhythmic theta activity, we would worry that it was a seizure.
Okay. This is not rhythmic. So it's
Yeah, it's not. So rhythmic would mean that if you take one of the waves and then you kind of shift it over, it will lay right on top of the next wave. Like it looks, very, very similar from wave to wave. Seizures sometimes do that. They also will kind of smoothly, evolve in maybe their frequency. They can spread to other parts of the brain, or we'll see some examples later. But this is what we would call just kind of well, don't want to say normal, but it's not seizure-like, it's not rhythmic, it's just run-of-the-mill theta slowing, irregular theta slowing. This is pretty typical in drowsiness or in mild, encephalopathy, which is what I would guess this is.
Okay. And some people call it polymorphic too, right?
Yeah, polymorphic means the same thing as irregular. Both of those just mean not rhythmic.
Gotcha. Cool. Okay. So
And I guess this is the other word people use for rhythmic is monomorphic.
Another theta example to look at. So let's do this one here. 1, 2, 3, 4, 5, 6, 6-ish, 7.
I think so. Yep. So there you can count 7. 1, 2, 3, 4, 5, 6, 7. I get 7, so maybe 7.5. And then up on the upper one, there's a circled around what looks like 1, 2, maybe 3 waves, 2 or 3. That would be a delta wave there.
What a trick.
So so this is very common for there to be, there's delta slowing and theta slowing together. So depending on where you look in the EEG,
Got it.
all superimposed.
Cool. Now the delta ones.
This is another, well, yeah, it is delta. So let's look at the middle lower one. Yeah, so I think I count 1, 2, 3, 4.
Okay.
So that is just at the upper end of delta.
Okay, got it. Okay.
And now this person, there's some green things circled too. What are those?
Yeah, those are more delta. 1, 2, 3, 4. Right? For her.
No. There's a clue down in the lower left corner.
Color coded.
Those are green eye blinks.
Oh my goodness, they're eye blinks. How do you know though?
Well, because they're green.
That's right.
Yeah, how do you know they're eye blinks?
Yeah, I think maybe because they're very interior, so they're where the eyes are at.
Yeah.
Both sides, because we have 2 eyes.
Some pirates though can get EEGs too.
All right, trick your EEGs.
Yep.
And just the morphology of them look distinct, right? A little different.
Yep.
Got
So
it.
then what state would you guess this person is in? Is this if you talk to this person, can they read this EEG?
Yeah, well, they're blinking their eyes, but it's pretty slow, so maybe they're drowsy or a little bit altered, encephalopathic.
Yeah, they're awake, but they're probably confused if you talk to them carefully.
So another example.
Yeah, so 2 hertz, or maybe, yeah, so I guess 2 or 3, 2, yeah, maybe 3. And then there's some theta mixed in here. If you look at those green circles,
Mhm.
1, 2, 3, 4, 5 hertz there.
Mhm. Mhm. One,
So,
2, 3, 4, 5. Yep.
yep.
Here, maybe even maybe some alpha.
Let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9. Yeah, I think there is some alpha overriding that theta.
Yeah. So that's a question I always get. What if you have frequencies in different ranges on the same waveforms? Which one do you go off by?
Well, for encephalopathy grading, what I think we're going to find, we're still doing some research on this, but I think we're going to find that it's best to describe them all, because you definitely see some EEGs where there really isn't any alpha activity.
Mhm.
And that's different that's a more severe encephalopathy, or brain dysfunction, than cases that have the combination of those. So I think we just note all the frequencies that you can discern is probably the best way to describe it.
Got it.
And so in a report, you just do what we're saying. You say you sometimes can say what the dominant one is if you want to convey to someone what you're seeing. So, predominantly delta slowing with, admixed theta and alpha oscillations.
Cool. Okay. So
Hmm.
even easier this one, eh?
Yeah, this kind of illustrates what we were just talking about. So this is one where there's delta, and it's maybe 1.5 hertz. Yeah, actually, I think 1.5 hertz.
Mhm.
And there's really not much theta or alpha
Yeah,
or beta or gamma. It's really pure delta.
that's right. It's naked delta.
Yeah. This is pretty severe, probably a severe encephalopathy. So yeah, so you can have, asymmetry can
Mhm.
be a difference in the amplitudes, even if the frequency, content is about the same on the two sides.
Mhm.
Um, or it can be a frequency difference, even if the amplitudes are about the same, or it can, of course, be both. And you can have varying degrees. So we use the term mild when the difference is, so for voltage, when it's less than 50%, but you can see it, then we call it mild. If it's more than 50%, we call it marked. And then for frequency, we call it mild if it's less than a 1 hertz difference, and we don't even mention it if it's less than half, because we probably can't really see that very reliably anyway. But if it's more than a 1 hertz difference, like on the example on the right, 9 versus 7.5, we would call it a marked frequency asymmetry.
Hopefully, we can have some examples now to practice this on.
Oh, look how lucky we are. There's an example right here. Can you describe this one?
Yeah, I think there's something going on here. Comparing to both chains here, and we usually try to compare the temporal chain to the other temporal chain, right?
Yeah.
The parasagittal with the other parasagittal. To make it fair, you have to
Make it fair. Yeah.
You have to be fair. And to the midline there. So compare these two, and these are the top to left temporal, right temporal. So I think the frequency, if we count the waveforms here, let's say we have 1, 2, 3, 4, 5, 6, maybe 7-ish with some faster frequencies on top,
Yeah.
predominantly theta. But then
Mhm.
here we just have like 1 or 2.
Yeah. Yeah. So this is a really clear focal delta slowing example with, or asymmetry in frequency.
Got it. Okay.
I think the amplitudes are probably not more than 50%, but it's you could measure that to be more sure. You want to do this one?
So what do you think here?
What do you think?
What do I think? So I think comparing left and right, it's pretty different. So I think the left side is, if you count, there's fewer waveforms in 1 second. So I think it's slower. So let's just do that together here. So 1, 2, really, maybe 3. In the same region, but on the other side, we have 1, 2, 3, 4, 5, 6, 7-ish.
Yeah.
So slower there. It's in the delta range because we learned that. And so that's a marked asymmetry in frequency because it's more than 1 hertz, right?
Yeah.
And then the amplitude is also a lot higher on the left, isn't it?
I think so. Yeah.
Yeah. So is it more than 50%, you think? I think it is, eh?
Yeah.
Okay. Here.
Yeah.
Okay. So we have asymmetry in 2 things. So here we would say focal delta slowing on the left with markedly asymmetric voltage.
Now, would you say that there's also generalized delta slowing?
That is a good question. Let's see. Let's look at the other side. Yeah, maybe a little bit here.
Yeah.
Yeah. Not as much though. I think it's more theta on the right, isn't it?
Yeah, I think so. So I would say on the left, there's focal, actually rhythmic delta slowing. It's focal rhythmic delta slowing, with markedly slower, markedly slower flowing and markedly larger amplitude on the left compared to the right. But and then as a separate finding, on the right there is mixed, theta. And to a lesser extent, delta slowing on the right side.
What is rhythmic? We haven't looked at a rhythmic example yet.
Well, here now we have, so I think this one is, if it looks pretty similar from wave to wave. It's not exactly the same, but they're pretty similar. You could almost take one and overlay it on the next one and the next one. And so it looks a little bit like a sine wave, like a very regularly recurring
I see. Okay.
oscillation.
Gotcha.
So we call that lateralized rhythmic delta activity, or LRDA.
Sleep.
Oh, sleep. So this person has a lot of blinks. They must really like blinking. Blink, 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 blink. Yep. And this looks like, so this is a person who's awake. If you look, I think they have a alpha activity that's somewhat localized to the back. I mean, it's maybe not a very well formed posterior dominant rhythm, but they have a alpha activity posteriorly where it should be when they're awake. So this is a normal EEG.
Wakefulness.
Yep.
And now they're asleep.
Spindles.
All right. So how do you know they're spindles though? It could be just beta, couldn't it?
It says spindles right there. But yeah, no. So the spindles are, well, first of all, they're kind of, so spindles can be in various locations. But they're usually frontal and central in their location. They last a couple of seconds. So here there's a 2-second spindle, and in the middle there's it's like a 3.5-second spindle. So they're about the right duration. They classically they kind of ramp up a little bit, and then they ramp down, so they have a shape that's apparently like a spindle. If you're familiar with muscle spindles, they look a little bit like that. And then and then the frequency, right, is so what's the frequency here? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, which is in the spindle frequency range, which I think is around 12 to 15, somewhere around there. And then I guess they have this little, the morphology is characteristic. I guess you would call it maybe archiform.
Yeah, sinusoidal-ish.
Yeah. And they happen, pretty frequently in stage 2 sleep. And they're related to learning and memory. So if you want to learn well the next day, you got to have a lot of spindles the night before. And if you've learned something and you want to remember it, it's a good thing to have a bunch of spindles the night after. They help transfer things from your inbox to the archive storage.
Nice. We like spindles.
Yeah.
And then one trick that's nice is if you see some eye blinks or other signs that the patient is awake, it's probably not a spindle, right?
Yeah.
Because they need to be asleep. And then you can maybe help differentiate from just beta activity, right? Sometimes.
Right. Yeah.
Okay. Got it. Okay. So that's spindles.
Here's another clue that can help. So sometimes they're associated with these big delta delta waves, which are K complexes.
Okay.
They look exactly like the letter K.
Do that?
No, not really.
You almost convinced me for a little bit.
They're big delta waves. They're I think they often look like this kind of,
Yeah.
A little bit asymmetric triangle, and spindles often go with them.
Like here's an example, right? Some spindles there and the K.
Yep. I think there's one over on the left as well. If you go, right there. Oops. Yeah, there.
A little bit of a sharpish K, but
that may be a vertex wave. I get actually come to think of it. What do you think?
Yeah, I don't know. It's a good one. As we need to.
Not the best example of one, but
I know you like average to look at sleep architecture.
I do, yeah. We can't though.
I can't, unfortunately. Okay, we'll go with this one for now. All right. So these are nice too.
These are vertex waves, actually. I don't know what I was thinking on the last slide. This is what they should look like.
It looks like. So they're phase reversing at CZ, highest amplitude at CZ. They have a field to the parasagittal regions, both sides. Sometimes one side more than the other, but usually both sides.
Right.
They're usually they are during sleep, from stage 1 and beyond, right?
Yeah.
Sounds good. So, and they can be pretty sharp and spiky, right? But they're still normal sleep architecture.
Right.
Yeah. So we're done. Should we just go over everything we covered really
quick? Yeah, let's do it. You want to just take turns?
Yeah. So I'll start. So background beta activity. It's just a matter of looking at the background, counting the waveform, seeing if it fits a particular frequency range. If it's 12 to 30 hertz, then it counts as beta. And one hint and important point is to differentiate when they're spindles, because they're still beta, but they're particular entity called spindles.
Yeah. And I'll take the next two. So alpha activity just means activity between 8 and 12 hertz. If it's diffuse, then that might mean somebody's falling asleep, or getting a little drowsy, or they're receiving some medications. If it's just limited or focused in the posterior region, head region, and there's eye blinks, then that's probably the posterior dominant rhythm, which is what happens when you're awake, and it's normal when you close your eyes.
All right, and then I'll take the next two because they're similar. So generalized, irregular, delta, and theta. So number one, they're generalized, they're everywhere. They're in the delta or theta range, so 0.5 to 4, 4 to 8, respectively. And they're irregular, meaning they're polymorphic, they're not rhythmic, and that's why they're called irregular. And they can be normal if their patients are asleep or drowsy, but they can also be abnormal, which is the case that we're looking at today, some encephalopathic patients.
Right. And then contrast those with the focal irregular delta or theta activity. So these same the frequency things mean the same thing as before, but the focal usually indicates that there's something wrong with the brain, that there could be a stroke or a tumor, or some kind of injury, scar tissue, making it abnormal just in one place when the rest of the brain isn't doing the same thing. And so this can, of course, happen together with generalized slowing, but it indicates something additional that's wrong in a specific location.
All right, and I'll take the next two, and I'll give you the last one because it's pretty rich. So asymmetry in voltage means, on looking at both sides, one side will be different from the other in terms of the amplitude of the waveforms. It can be mild if it's less than 50%, and it can be markedly asymmetric if it's more than 50%. And those eye blinks, we can see more in the frontal anterior leads as they're closer to the eyes, usually bilateral. And they have this triangular morphology that are very, very specific, distinctive.
in the asymmetry could also be a frequency asymmetry if it's mild if it's 0.5 to 1 hertz, and then marked if it's more than 1 hertz.
Correct.
So I'll take the last one. So sleep transients. These are all things that are primarily in stage 2 sleep that we're listing here. So spindles, these little few second long periods of really fast oscillations, kind of in the frontal and central regions, and then K complexes, which are big delta waves during sleep, sometimes associated with a sleep spindle, and then vertex waves, which are most prominent at the vertex, and they're usually symmetric around the vertex, and they look a lot like spikes, but they're normal in stage 2 sleep. That's it.
We did it.